I am Linda Snyder. I'm Vice President of Family Planning Programs with Adagio Health, and I've been there for about 35 years. Adagio Health has been the Title X grantee for family planning under the federal government for, since 1971. In that time, we have focused on clinical care and services, but priorities have changed to start looking at all of the external impacts on a client so that we can look at social determinants of health, look at a person's life environment and what's going on around them. And in the time, priorities have changed to not only provide the clinical care, but also to screen, to make sure the clients we serve are safe and healthy and that they're not victimized. And in the time, the federal government has begun to prioritize things such as safety, examining people and making sure that they're not suffering from reproductive coercion, that they are not victims of domestic violence, that they're not victims of human trafficking. So that has been a high priority with that particular funding stream for many years now. We started to address it because of the region that we're in. This is a hub for human trafficking. We are the crossroads for a lot of trafficking roadways, and it's created a problem for human trafficking. So many years ago, we began to look at how we can help our network better serve people and to screen and make sure that they were safe, get them help when they needed help. And we worked with some people from like Forbes Hospital who came in and did training for our entire network on how to recognize domestic violence, how to assess if a client might be a potential victim. We have our network doing innovative things within their own offices. We have found that traffickers don't leave people alone. They come with them everywhere they go. And they do unusual things such as leaving a cell phone in the victim's pocket and it's turned on. We have always talked to clients privately, and that's to help, protect them from maybe an intimate partner violence situation or from trafficking. And we pull them into an exam room always to talk in private. But they will leave a cell phone turned on their victim and listen. So we have done some other unique things, such as putting signs inside a bathroom stall. And that's one place where especially a male trafficker is not going to go with a female victim into the bathroom. And things like if you're in a dangerous situation, if you need to talk to us, if you need help, put one of the blue stickers on your specimen cup on the bottom, and we will get you a loan and we will help you. So we've got a lot of those initiatives coming forth to try and address the situation. I sit on the state interagency work group on human trafficking, where you have key people across the Commonwealth working to try and raise awareness about domestic violence, trying to stop the situation. We have found that people in our area, maybe not Pittsburgh, but I live in Lawrence County, so maybe in very rural Lawrence County, doesn't happen. Those things, they might happen in Philadelphia, they might happen in Pittsburgh. They happen everywhere. Down the street from you, maybe next door to you, around the corner from you, they're all over. It doesn't matter if you're in a city. And so that's what we are trying to raise awareness about and let people know it happens everywhere and for all kinds of reasons. And it's our responsibility to try and identify, to try and provide help when we can help a person, to give them resources to get out of a situation if that's what they choose to do. Any one of our clients could potentially be a victim. That's what's scary. Because of the work we've done with training our network and helping them to find ways of assessing if a client's a potential victim, we have identified victims. We had a victim in Allegheny County that had been trafficked by a former law enforcement officer. And we're able to help that person and get them out of the situation. So what I've realized is there's no one look to what a victim might look like or someone who's being trafficked. Not one gender. It can be males. It can be females. It can be sexual trafficking. It can be labor trafficking. Any single person we look at might be someone in need of help. We do annual trainings. It's part of our federal grantee requirements. So we have made that a requirement for all partners. Last year, almost 900 of our providers. So this is across a very large network in Western Pennsylvania. And they all do mandated training. One of them is on human trafficking, being able to recognize signs of human trafficking. We have guest speakers come to our annual provider network meetings. Last year, we had a wonderful state trooper who provided great training on how to recognize people, explaining the circumstances that go all the way across Western PA, from the West Virginia border up to the New York border, where victims are everywhere. And the work that needs to be done to try and provide, locate these people and provide help that they need. And then we also are doing our work to raise awareness about the situation and doing social media posts, putting information on our website and trying to get the word out about potential victimization and how to help people. And particularly if a client's in need, where they can turn for help. I think it's important for everybody to understand there's no one picture of someone who might be a victim of human trafficking, not to be judgmental, to understand people are coming from different positions and may have been forced into a situation because they felt they had no other option, and to keep your mind open, keep your eyes open, and watch and be willing to help if you can help, and direct people to where they can go for help.
Well, my name is Kristin Malone-Bodair, and I'm the Education Outreach Manager for Blackburn Center. And we are located in Greensburg, Pennsylvania, but we cover all of Westmoreland County, providing services for domestic violence, sexual violence, and other crimes. We provide direct services to clients. We give them options, and we have various options, including a hotline that runs 24 hours a day. We also have a shelter for those who are experiencing intimate partner violence. That's a safe place where they can go and be safe with their children, and that's inclusive of all persons. We also have medical advocacy. We go to the emergency room 24 hours a day to support victims and survivors of physical or sexual violence. And a lot of people don't know that that's something that we offer. And then, of course, we provide education, programming, and that's something that, I do with my staff. And one thing that we do in particular is that we are the coordinator of the Westmoreland Human Trafficking Task Force. And that's made up of, many other agencies and people who are interested in the prevention and spreading the word on what's happening in Westmoreland County due to trafficking. There has been several movies out there recently, and many times people have this image of somebody being kidnapped, taken away, and put into trafficking. And that is the reality in some cases, but we like to focus on what's happening here in Pennsylvania. And so that's not necessarily the case when we think of trafficking. So in our state in particular, we know that statistically 40% are trafficking incidences that happen in intimate partner relationships. And so that's why Blackburn's involved. And also family and friends make up another 45% in sex trafficking. So what we see happening in Pennsylvania is rather a higher level of sex trafficking than labor trafficking, although it does exist. I just kind of want to define human trafficking. So many times it's called modern day slavery, and that's kind of a jolting term, but it's really stealing somebody's freedom for profit. And internationally, around the world, it's a $236 billion industry. And it's about 50 million people who are, kind of obtained for trafficking purposes. And when we talk about human trafficking as a crime, there are kind of three elements to it. And the first one is the act. And so there are those instances where somebody's taken or they're obtained. Sometimes we think about across our borders, migration, that they're a very vulnerable population. And when they come over, they might perhaps get trapped into trafficking. So that is a way where somebody's obtained or kind of that like isolated or kidnapped situation. But there's also advertising or solicitation that's part of the act. So many times it happens online. And so people will be online and not realizing that maybe the person that's talking to them that wants to get into a relationship is a trafficker. So it's part of the grooming process when we talk about the act. Now, the next step is called the means, and that has to be present: force, fraud, or coercion. And that can happen online when somebody lies about their intentions, and then ultimately they use that person or blackmail them into, using them for trafficking. And the last part is purpose. So there are two reasons that there is trafficking or involvement, and that's either sex or labor trafficking. When I speak within our community, many people are shocked to find out that Pennsylvania is now 9th in the nation in human trafficking. We sometimes have, this image that it only happens maybe in the big cities, New York, LA, Miami. But honestly, we are one of the top states where prosecutions of human trafficking occurs. And so we do think that, it moves out of the ports, New York, New Jersey, into Philadelphia, which has the highest concentration of counties that have human trafficking. But as we get to our side of the state, Westmoreland County is the only state or the only county on this side of the state that has the highest level of human trafficking, and they are ranking in the top 10. And so it's very surprising, and many times people will say, well, why is it in Westmoreland County at that high rate? We're not sure, but we do know that we have a lot of transportation hubs like Newsstand, where, we have the intersection of 70 and the Turnpike. We also have 66 and 30, many times going from north to south, east to west. So we believe that traffickers may think this is an easy way to get on and off very quickly and out or in the county. The majority of trafficking victims in the state of Pennsylvania are adults. And that's a surprise to most people because the image is that it's minors. Nationally and internationally, the average age of human trafficking is 12 to 14. So it does happen to minors, and it's really important that, we do prevention and education awareness with them as well, because they can be in danger when they're online if they don't realize who they're talking to. And that gets to the difficulty of, identifying, self-identification of being trafficking and other people identifying trafficking. If we know that 85% of sex trafficking goes on in PA at a family level or a relationship level, many times people know the person that's trafficking them. They love the person that's trafficking them. So it's very difficult for them to come forward. And also many times in the process of grooming, that person becomes very connected to their trafficker. Now, they use different means of control to keep them in their place, but that bond might be the strongest one. So somebody who's in trafficking, they may be able to come and go as they please. But in other situations, they are handled by their trafficker very tightly, and they can be threats of physical or sexual violence. They may get somebody addicted to drugs and alcohol. They may threaten their family. And there's quite a lot of tactics that they will use to keep somebody in place. If somebody has that means, even if they consented beforehand, if there is that force or fraudulent behavior or coercion, it is trafficking. Now, I do want to point out in the case of minors, you do not have to have force, fraud, or coercion. Anybody under the age of 17 cannot give consent to any sex or labor trafficking activities. Sex trafficking, a trafficker will manipulate, they will threaten, they will control somebody to do a commercial sex act. And maybe the image is that this happens like in person, but the majority of it now happens online. And so they will maybe groom somebody. They think that they're in a relationship. Maybe they become boyfriend and girlfriend, and the relationship is going really well. But the person who is the trafficker knows all along that they are grooming them to do a commercial sex act. A year ago, we just had an arrest of a man from Ohio who had 3, I believe, women in a motel room, and he was trafficking them from that motel. I just want to point out that it's really important for the community to really be aware of what's going on. In Murraysville in 2018, there was a massage parlor called Tokyo Massage. And it wasn't the authorities that, arrested the traffickers there that had the massage parlors. It was actually neighbors that were adjacent to the property that saw, and this would be international trafficking, women there hanging up clothes, living there 24 hours a day. And they intervened. They got the local authorities involved. And I think that plays such a high-level role for our community members to know that they can make a difference and, they can stop trafficking here in our community. As Blackburn, we have that 24-hour hotline. And so, victims and survivors of trafficking can call in and we can support them. But it goes beyond that because many times people will not reveal that because of fear or because there are traffickers right beside them and they are talking for them. And so those are some red flags that somebody may be trafficking. Also, having tattoos that may show that ownership or money tattoos could also be a potential red flag to human trafficking. Not knowing where you are, what the time and date is, all of those lead into suspecting human trafficking. So it is a very difficult situation because many times traffickers speak for their victims. Many times traffickers will traffic young persons and then they will ask them to recruit for them. And so it could be anybody. And also, victims can be anybody. Survivors can be anybody as well. Age, it doesn't matter. Gender doesn't matter. So we all could potentially be victims of human trafficking, but there are some vulnerabilities that show up. And some of those vulnerabilities deal with, societal ills, poverty, discrimination, oppression. Housing is a very big issue. Not in Westmoreland County, there's been a rise 25% after COVID in homelessness. So that plays a large role. Runaways. We do know that a trafficker within 48 hours average will find a runaway and connect with them. And so those vulnerabilities can lead to somebody in that situation. I also want to point out that addiction plays a very large role as well. So many times traffickers will hang around methadone clinics and start a conversation and become friendly with the person. They will then, knowing that they have an addiction, get them re-addicted to substances. They will provide them with drugs and then they will withdraw them. And then they will ask for them to do a trafficking act. If a person's being trafficked, maybe they don't want you to intervene. Maybe they don't feel safe for you to intervene, or maybe they don't even feel like they're a person being trafficked. And that's what makes it extremely difficult. We do like to say, though, if a young person, particularly a student, is in school and you might see changes in their behavior, maybe they do have an older boyfriend, and this leads to them maybe missing school. Maybe all of a sudden they have all these new clothes or designer shoes and purses. Maybe they don't want to hang out with their friends anymore. Those could be red flags that maybe they're in a situation that is trafficking or leading to trafficking. Now, in public, again, it's very difficult. If you do suspect that somebody's being trafficked, you do have to worry about your safety because this is a very dangerous situation. And so there are places that you can quickly text and call, like the human trafficking hotline. You can text help to be free, and then they can give you directions. You can contact your local authorities and make sure that you get a description. There is hope for healing. We are here to help victims and survivors of human trafficking. It is a very difficult, maybe long time to heal, but you can heal from the situation. You have survived.